The highest court in the land has now spoken. We will continue to implement this law.
We must replace Obamacare. That is my mission, that is our work, and I'm asking the people of America to join me.
Welcome to DC Bureau, the weekly politics show of the Wall Street Journal. I'm Jerry Seib. A momentous week in politics because of the Supreme Court's decision that largely upheld the Affordable Care Act, President Obama's health care overhaul. We hit the road to gauge the impact, coming here to Capitol Hill to see what lawmakers think, and going out to Chicago to visit with Stephanie Cutter, deputy manager of the Obama presidential campaign. Stephanie, thanks for joining us.
Thanks, Jerry. Thanks for having me.
The decision was a big one and clearly a big victory for the president. His signature domestic initiative upheld by the court, but it comes with some political complications. In particular, the court said that the individual mandate is in fact just a tax on those people who don't have health insurance. And Republicans, starting with Mitt Romney, have jumped right in and said,
Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations.
What's your response to that?
Well, I would say a couple of things. Effectively, there's no change in the law. What the law says is that most people have private insurance, as you know. Those that don't probably don't have it because they can't afford it. So the law provides the largest middle-class tax cut in history to help people afford health care. So for those who get a tax cut or can afford it and still choose not to get it, there is a penalty. And that is estimated at about 1% of the American people. Now, the same model was used in Massachusetts. In fact, Romney Care was the model for Obamacare, where a mandate was required. If you could afford it, you had to get insurance. If you didn't, you paid a tax penalty. So, at the end of the day, there's no change in the practical effect of the law. And lots of things, we're going to continue moving forward on. Prescription drugs for senior citizens, ensuring that kids with a pre-existing condition can get the care they need, or preventive care, whether it's mammograms or blood pressure checks, people can now get with no out-of-pocket costs. So there's no practical effect of the decision. We're going to continue to implement it, and the people who are already benefiting of it aren't in danger of losing it.
You know, Stephanie, one of the interesting things President Obama said in his reaction to this was that maybe there are ways to improve the Affordable Health Care Act.
The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can.
Do you know what he was referring to and what kind of improvements he might have in mind?
Yes. In fact, last year, he actually supported a way to improve the law. Right now, in 2017, the law is fully implemented. If states have a better way to reach the same benefits and cost savings and coverage, then they can opt out of the Affordable Care Act and innovate and put their own plans in place. The President supports moving that date up to 2014. So as we continue to implement the law in 2014, when it's fully in effect, if they discover they have better ways of doing this in ways that suit the needs of their states, then the federal government is open to it. So the President is in favor of moving up that date to allow states to opt out. That's called the Wyden-Brown bill in the United States Senate. The President came out for that over a year ago. That's a significant way to improve the law and promote innovation at the state level.
Let's talk a little bit more about the politics of this. You know, one of the things Republicans are clearly trying to do is use this decision to mobilize their base by essentially saying only Republicans in Washington can drive a stake through the heart of Obamacare. That's probably a pretty effective mobilization line for them, isn't it?
Well, Jerry, I'm not an expert on the Republican Party, but I do know that that's what they've been running on for the past 2.5 years now. And I'm not sure that's enough. Most Americans, an overwhelming majority of Americans, don't want the law repealed. Some of them want it to be improved upon. Some of them don't think it goes far enough. So if that mobilizes the far right wing of the Republican Party, then that's fine. But for the overwhelming majority of the American people, they want the law intact. We can improve upon it when needed, but they want to move on. They want Washington to turn their attention to the economy, and that's what the president is urging Washington to do.
You know, the other thing Mitt Romney said for his part was that we can save the popular parts of this bill even if we kill the rest of it. We can save health insurance for younger people. We can save health insurance for people with pre-existing conditions. What's your reaction when you hear those kinds of things?
Well, I think he's not telling the truth about his position on saving protections for people with pre-existing conditions. What his position is actually been the law since 1996, that if you have coverage now and you change jobs, or you lose your job and go on COBRA, then you can't lose your coverage because of a pre-existing condition. But what that doesn't mean is that if you have a new pre-existing condition, or if you lose your job and don't have the ability to go on COBRA, you have no protections at all. So what he is saying when he says that he wants to cover people with pre-existing conditions, he just wants to go back to the old 1996 law that really did nothing to ensure that people who were sick couldn't afford coverage because they were priced out of it, or were denied because of insurance companies' abuses, that those people remain without coverage under Mitt Romney. So he's just not telling the truth about what his position is. And you know, back to your original question about saving the popular pieces of the law, we're all for that. We want to continue implementing the law. There are millions of Americans already benefiting from this law right now with better quality care and better security in knowing that their health care will be there when they need it. We're happy that he wants to support the popular things, but you know, this is typical Mitt Romney. He's not willing to make the tough decisions and to get true health reform done. As the president said today, he didn't do this because it was politically popular. He did it because it was the right thing to do.
Stephanie, let's just cast forward finally, just briefly. You know, we're all obsessing with healthcare right now. As you note, it's not necessarily politically popular. How much is the president really going to want to talk about this over the next 4 or 5 months?
Well, he talks about it all the time, Jerry, on the campaign trail. It's a significant accomplishment of the last 3 years since he's been president. It's a significant accomplishment because, as I said before, there are tens of millions of Americans already benefiting from the law. So he talks about it all the time, and we talk about it all the time. We're proud of the fact that after 70 years of trying, this president finally got health care reform done. And we welcome a conversation with Mitt Romney on health care, our opponent. Again, you know, he was the author of Romneycare in Massachusetts. Romneycare was the model for national health care reform. Mitt Romney called the individual mandate essential in enacting health care reform, and we agree with him. So we are open to this debate with him, welcoming the debate of him, and we look forward to what his ideas are for health care reform, since he wants to repeal the president's health care reform. In his words, he wants to kill it dead on day one. So what does that mean for the tens of millions of people that are already benefiting from it? We thought his statement today was completely callous and disregarding what he would do with the people who are already benefiting, saving money, ensuring their kids can get care, senior citizens getting preventive care without no out-of-pocket costs. What about all of those people? Mitt Romney just cast them aside in the name of politics because he's seeking the presidency. He completely changed his tune from his own health reform law in Massachusetts.
Well, Stephanie, it sounds like we're going to get to have that conversation over the coming weeks, and I'm glad we got to start it today.
So.
Thanks for joining us. Hope we can do it again.
Thanks, Jerry.
Let's talk a little bit about the practical effect of the health care ruling with Congressman Chris Van Hollen of Maryland, who was on the Ways and Means Committee when the Affordable Care Act was written, now the top Democrat on the Budget Committee. You've seen it from a lot of angles. Let's start with the first thing that happens here in Congress, which is the Republicans who run the House have scheduled a vote on July 11th to repeal what they call Obamacare. What happens on that day, and do they get any Democrats to go along when that happens?
I don't think they get any Democrats. It's an empty political gesture. In fact, if you remember, the very first vote the Republicans had in the House when they took control was to repeal Obamacare. And of course, it went nowhere in the Senate, and this will go nowhere in the Senate again. In fact, now we have a very positive Supreme Court decision in support of the law. So this is pure politics. But I do think people should understand that they're calling for the full repeal of it, which means that families that are keeping their kids on their insurance policies till they're age 26, or seniors who don't have to pay as much on prescription drugs would immediately lose all those benefits on the Republican proposal, and they haven't gotten to the replace part.
But Mitt Romney said immediately, we'll save the part that says you can get insurance if you have pre-existing conditions. We'll save the part that says your kids can stay on your policy till they're 26. Can they save those things?
Well, of course, Mitt Romney knows better, and that's the great irony here, because when Governor Romney passed the law in Massachusetts, he understood that in order to make sure people weren't discriminated against because of pre-existing conditions, you had to get everybody into the pool, into the risk pool. Otherwise, people game the system. And he understood at that time that you don't want to reward the freeloaders and the free riders. And all of a sudden, he's done an about-face on that issue. The only way you deal ultimately with the question of pre-existing conditions is the way Mitt Romney did it in Massachusetts and the way we did it in this law, unless you want to do a Medicare for all type
Because
approach.
the pool isn't big enough to allow the insurance companies to cover everybody. That's the argument.
Well, that's right, because if you don't have everybody contributing to the pool, then the reality is people who have pre-existing conditions, they can wait and just join the pool. So
let's talk a little bit about the other part of this ruling, which is a little less politically charged, but in some ways kind of a bigger policy question maybe, which is the court also said that states do not have to participate in the bigger, more robust Medicaid program that the law envisions. They can opt out if they want to. That's a problem because you don't then get the kind of broad, nearly universal coverage that the law envisions. What's the practical effect of that? What will the practical effect be, and what does Congress do to adjust to that?
Well, I don't think at the end of the day states are going to opt out of this, and here's why. Right now, every state participates in the Medicaid program, which of course is a federal-state share. Right now, on average, you have $6 of federal contribution for every $4 of state contribution. That's the average. Under this part of the Medicaid law, the Affordable Care Act, the match is much more generous from the federal government. In fact, for the first 4 years, it's 100%. 100%. So the federal government picks up the entire costs. And after that, beginning about 10 years from now, it goes to $9 of federal money for every $1 of state money. Right. So for a state that's taking $6 of federal money for $4 of state money now, it's hard to say how they tell their people they're not going to take $9.
So why then did you have 26 Republican governors join a suit that said, please overturn this law so we don't have to participate in that Medicaid program?
Well, I think that Republican governors got very engaged in the overall political battle. Of course, their court briefs did not include only this particular piece. But those governors, those Republican governors, have the option of opting out of Medicaid today, where they're getting $6 of federal funds to $4 of state funds. They haven't chosen to do it, so I think they'd have to tell their people why they would turn down $9 in federal funds to $1 in
And your
state
prediction
funds.
is they're not going to do that. They're going to join in if this
My
carries
prediction
forward.
is if you're a governor of a state, it would be great negligence to deny the people of your state the ability to get affordable health care when the federal government was putting in $9 to every $1 of state money.
Let me ask finally a political question. You ran the Democratic House Campaign Committee for a couple of cycles. You know how these things play out in the country. What's your advice to Democrats running in tough House seats right now about how they should discuss health care in the Affordable Health Care Act?
Well, I think they should talk about the fact that the Affordable Care Act will do two things. Number one, it will make sure that everybody can get insurance and no longer can be denied by health insurance companies because of pre-existing conditions, one. Number two, that when this bill is fully phased in, starting in 2014, it will bring down health care costs because it will finally create these exchanges, supermarkets, where different health plans will have to compete for people's business, very much like the federal employee health benefit plan that members of Congress have. And that will drive down the costs over time. So you get everybody into the risk pool. Everybody has to contribute. No freeloaders, because right now, when somebody doesn't get health care, that raises the costs through premiums and taxes on everybody else. So this will help rationalize the system and bring down costs.
But if I'm your hypothetical congressman and I say to you, it's still not popular, Chris, what do you say?
Well, I know what happened at the beginning of this debate. It was demagogued to no end. People said there were going to be death panels. There are no death panels. People said this was a government takeover of health care. The nonpartisan PolitiFact fact checkers said that was the lie of the year in 2010. Then they said it was blatantly unconstitutional. So all of that has been just proven false. What you find is that people like the specific provisions when they hear about them. And where we need to win the debate is on the overall issue. So we need to sweep away all the demagoguery and talk about what this does and means in people's lives, bringing down healthcare costs, providing greater access.
Something tells me we're just starting that part of the conversation, so I hope we can...
We are, and I think that will have a fresh start. And I do think it's worth reminding people why it was that Mitt Romney thought this was a good idea when he was governor of Massachusetts. One, you can finally make sure that people aren't denied coverage because of pre-existing conditions. Two, he recognized that when people contribute nothing to the healthcare system and their own healthcare, it means everybody else pays a lot more. He made the right argument then. Turns out that when President Obama was for it, he decided to be against it.
Thanks for joining us today to talk about it all. We'll take a deeper dive into the politics of the healthcare decision when we join our meeting in progress next.
The temptation for the Democrats and for Obama to spike the ball was huge.
How does Mitt Romney address this issue when President Obama puts it to him on a debate stage?
And there's still this big chunk of people, over a quarter of all people, who just don't know what to make of it.
Wall Street Journal Live.
It's so much more than the Wall Street Journal.
The new digital network from the Wall Street Journal.
It's really a collection of channels,
all packaged on the web.
Featuring a daily lineup of original programs, live and on demand.
No one has done anything like it.
So the big news of the week was clearly healthcare, and I love it when conventional wisdom is wrong.
Yeah, absolutely.
And this is wrong, right? Nobody thought this was the way it was going to turn out.
Yeah, I mean, what would have been 80% of folks here in D.C. anyway thought absolutely this is going to go against Obama. May not be entirety, but that it was going to in some fashion.
Well, and I think that, you know, everybody prepared for 3 different options, you know, strike it down,
Or 5.
uphold it, or but I don't think very many people thought that this was going to be the way it would be upheld.
But ironically, this may be the option, though, that it doesn't change the dynamic of the race as much as the other ones would, because essentially the race is the same now as it was on Thursday morning before they made the announcement, because Mitt Romney is still against the health care law, Barack Obama is still for it, and it still divides the bases of the party pretty evenly.
Obama's whole thing, you saw him come out, and this is already, you know, you can see the movement among Democrats. It's just like, let's close the door on this now. It's done. You know, Congress passed it, President signed it. Now the Supreme Court's ruled on it, so it's done, let's move on. And his whole message was, let's implement it, and if we need to tweak it here and there, fine. But otherwise...
That tweaking thing, we hadn't heard that much before. I mean, they said, well, yeah, we can improve this. I've heard other Democrats say the same thing. I've asked them, what do you say about health care in this campaign? And one of the things they say is, well, we should say the law is basically good, but we can improve on it. And that's kind of what the president opened the door for that Democratic line.
Yeah, I was really struck by it. It was kind of clever of them to not. I mean, beforehand, the Republicans were talking about how they shouldn't spike the ball in the end zone if they win. I mean, in this case, the temptation for the Democrats and for Obama to spike the ball was huge. But they came out and they said, you know, we understand that this is an unpopular law, and that they didn't put it that way. They said, we understand that there are things.
The politics of this are going to be interesting, though. I mean, Roberts bridged. He made it the 5-4. He gave them, you know, the Democrats a big victory, but he put the word tax out there. And he said, no, this isn't an individual mandate like that. It's a tax. It's a national tax, essentially. And, you know, Republicans have jumped all over that, and they're going to use that. If they have anything that they can go towards November, it's going to be that this is a tax that Obama has put on you.
I'll be curious how specifically Romney actually goes at both the decision and the law itself. I mean, he's really been talking in kind of broad promises, and I think that the decision allows him essentially to keep doing that between now and November. You know, he has not promised a lot. He has not given a lot of detail, and I think this decision now allows him to kind of keep proceeding apace because this is kind of a thicket for him. If he were to offer a detailed prescription, there's a really good chance that conservatives wouldn't like what it is.
I mean, that was the sense all along when they were in the primary. You know, Santorum and the various of the others said, this is not, if it's going to be a healthcare election, we do not want Mitt Romney to do it. He's the, you know, the father of healthcare.
Word Romney care is out there. But you know, there's another level which tends to get ignored. This will play out maybe bigger on the congressional level because it's a base mobilization thing for Republicans. I mean, you're on the Hill, you know this, maybe I'm wrong here, but Republicans in Congress are much more eager to say in the aftermath of the Supreme Court decision, this shows you why you have to elect Republicans to repeal Obamacare. And they don't have the Mitt Romney baggage problem, so they're going to say it louder, I think.
Right, they're going to say it louder, and they're going to stage votes. Actually, Eric Cantor immediately announced that in the House they're going to have a vote to repeal Obamacare one more time right after the 4th of July. They want to talk about it. They want to go on the record about it. However, I did notice that even John Boehner, the Speaker of the House, when he came up and gave his response, even he seemed kind of eager to move on to say, well, the real reason why we don't like Obamacare is it hurts the economy.
Right, but they were fundraising like crazy. Even the night before the whole thing, Marco Rubio put out an email, basically, what if this is a 5-4 decision upholding it? We need to raise money to make sure we can
Well, and you tweeted right away that they started to raise money, or said they started to raise money in big amounts instantly.
No, for the Romney campaign.
Right.
The Romney campaign, I think in the first 3 hours was saying it raised $1 million was coming in after the decision. So that's the base mobilization.
I think I got my first email maybe within an hour of the decision being announced. I got an email from a member of Congress saying, hey, let's start the fight. And it was Michelle Bachmann, a Republican. I expect we're going to see a lot more of those. And I'll be really curious to see what the dollar amounts are on those 24-hour period, because you got to imagine that the base is, as you said, really, really fired up now.
Here's another subtle thing that I think is one of the effects of this that people won't talk about very much. If it had gone the other way, I think that President Obama and the Democrats were really susceptible to an argument that, they're really just wild-eyed, crazy socialists who are way out there on the fringe. If the Supreme Court had overthrown his signature domestic policy decision, then that would have been a better argument, easier argument for Republicans to make. Now that the Supreme Court has said, led by a Republican Chief Justice, well, I guess it can be constitutional. It's a little harder to say they're totally out of the mainstream.
Well, no, and that is the icing on the cake for Obama. I mean, it's great for him politically that his signature achievement has been upheld, but the fact that it was upheld by one of the most conservative justices, even though he did, as Neil was saying, offer a complicated rationale for it, it's hard to say that it's a crazy socialist scheme if John Roberts upheld its constitutionality.
I want John Roberts writing, political points for my party. He's very clever in the way he did this.
Yeah.
If it had been Kennedy was that fifth vote as opposed to Roberts, it would have been a totally different, the cosmetics of the whole thing, the atmospherics would have been different. I mean, this was the golden boy that, George Bush put forward, became the Chief Justice, and he wrote the deciding opinion.
I think it makes the political debate very simple, and it also kind of helps both sides avoid a very messy policy debate, because I think neither the Democrats nor the Republicans, Romney nor Obama, had a very good idea of what's next if part of it had been struck down.
That's true. The replace part is always always going to be the tougher part for Romney than the repeal part.
Yeah, no, absolutely. Romney was in a bind, I think, if the Supreme Court had rejected the individual mandate and he had been required to actually show a little bit more skin than he already has, that was going to be very difficult for him, just because he is the father of this Massachusetts law, which Democrats have already argued and will continue to argue was the father of the national law that's become unpopular.
See, the other reason this was always going to be tricky for both sides, and it was never going to be a clean win for either side, is what we found, I think, in the polling that you both wrote about this week in our Wall Street Journal NBC News poll. It's not just that opinion is divided about Obamacare; it's splintered. Right? It's like in 3 or 4 different categories.
It's not exactly even thirds. I mean, there are more people, a plurality that didn't think it was a good idea, never did. But it's never really changed since it was signed into law in March of 2010. And there's still this big chunk of people, over a quarter of all people, who just don't know what to make of it. But it's not this huge contingent that wanted to see it overturned.
But on the other hand, it never became popular. It has
never
been
became
popular.
But to the extent that the people who haven't made up their mind are independent swing voters, then it almost hasn't changed the dynamic of what we're dealing with as far as the election is concerned, because these are people who had not made up their minds about the law, and they have not made up their minds about the race itself and who they're going to support.
Independents still generally don't like it in higher numbers than certainly Democrats. So.
But it's hard to see somebody's opinion about the candidates changing based on this decision. I mean, really, it basically ratified what
they talk
everybody
about
already knew.
Mobilizing the base. I mean, this may mobilize Romney's base. His
but
base is already mobilized, and if he doesn't have his mobilized base, he's in a lot of trouble anyway.
Yeah, but it does help. This does help mobilize the base for him, I think. And the reverse would have been true for the Democrats. I think they've lost the base the Democrats have ironically lost the base mobilization of having to fight for health care, and the base mobilization of saying, well, these are crazy Supreme Court justices. They just threw this thing out. We need more Democratic Supreme Court justices. Well, that doesn't sound quite like the same argument.
It's been funny to watch the Obama camp embrace the word of Obamacare.
Yeah.
And I kind of wonder whether they're going to do that all the more. I mean, it does put care with Obama, right? And you want your president.
I've never quite understood why people thought that was a slur, except for if you hate Obama. But
here's where they've come together in the aftermath of this. They're both now highlighting the popular parts of the bill and saying we got to hang on to those. That's a Romney line.
Absolutely. No, he's already talking pre-existing conditions. He's been talking it for a couple weeks now. He had talked about it when he first offered up his own alternative. So I think we're going to hear a lot about the popular things that were in the bill. But
okay, summing up question. So this is not a clean break for anybody. This is kind of messy and complicated. Does it make healthcare a topic that is going to be talked about more or less from here on out than it would have been otherwise?
I'd say less.
I would probably say less. I think the big question I have is how does Mitt Romney address this issue when President Obama puts it to him on a debate stage in the fall? I mean, does he own the attack, and does he get any more specific than he would? I don't see how he can benefit from taking the debate much further than he already has, and so for that reason, I don't think we're going to see a huge change.
Yeah, I think there's a flash in the pan. We talk about it a lot, and then it goes away because really neither side wants to talk about it much because it's such a mixed thing for Obama. It's his accomplishment, but it's unpopular. And for Mitt Romney, he feels like what he really wants to talk about is the economy.
I'm with you. I think for a couple of days and then less over time. So we learned this week just how fast the political world works, and we learned it by watching dueling ads from the Obama and Romney campaigns. We'll look at those when we come right back.
Wall Street Journal Live.
It's so much more than the Wall Street Journal.
The new digital network from the Wall Street Journal.
It's really a collection of channels.
All packaged on the web.
Featuring a daily lineup of original programs, live and on demand.
No one has done anything like it.
Day one, President Romney stands up to China.
Romney's never stood up to China.
I think we all knew that campaigns move faster now than ever before, but this week we found out for sure that, and we found out, at least I found out, in an advertising war. Two Romney and Obama ads back to back. We'll watch them both and then let's talk about them.
President Romney's first 100 days. What will they mean for Ohio? Day one, President Romney stands up to China, demands a level playing field for our businesses and workers. By day 100, President Romney repeals regulations that are strangling our energy industry and costing us jobs. President Romney's first 100 days. For Ohio, already a better place to do business as we see more factories and jobs coming back.
I'm Mitt Romney, and I approve this message.
I'm Barack Obama, and I approve this message.
Day one, President Romney stands up to China.
But would he? The Washington Post has just revealed that Romney's companies were pioneers in shipping U.S. jobs overseas, investing in firms that specialized in relocating jobs done by American workers to new facilities in low-wage countries like China. Romney's never stood up to China. All he's ever done is send them our jobs.
Okay, so Neil, you wrote about the Romney ads, which were really clever because they were tailored to individual swing states with different messages.
It was kind of what we've seen as sort of an innovation on an innovation. The first was that they came out, and I've talked to people who did the McCain campaign. They never did anything like that, which was ads specifically tailored for four different states, making different messages all in 30 seconds.
So the one we saw was the Iowa one.
The Ohio one.
Ohio, sorry. There was an Iowa one. There was a North
Virginia,
Carolina.
North Carolina. And they all emphasized different things. One talked about going after China, the Ohio one. Then there was an Iowa one that talked about reducing the debt and so on. And then, fast forward a week and we see the Obama people using several of these ads, actually. The first opening frame, essentially, and then going after saying, oh, you say you're going to do all these great things on day one. Well, you're an outsourcer, and let me tell you, viewers.
So it takes less than a week now to take the other guy's ad and turn it to your advantage or against him.
It's amazing. The technology that these campaigns possess right now is really amazing. In Chicago, there are these edit bays. There are probably 12 of them on the main floor
Obama headquarters.
in Obama headquarters, and they can splice these things immediately. Traveling around with the Romney people, Stuart Stevens, his main strategist, travels with an iPad and a MacBook, and he can basically cut ads on the fly on the back of the bus, and they can get sign off from the candidate right there. So it's really amazing.
But I gotta say, the thing that caught my eye in that Ohio ad was buried in there was a little acknowledgement that the economy was getting better in Ohio.
Oh, yeah.
Yeah, that's true.
And I thought, wow, that's a pretty big concession.
I know, that was funny. It was a subliminal thing. I mean, semi-subliminal, but when I highlighted it in our story, I got an immediate note from the campaign. No, we're talking about how good it's going to be after he comes in, and it's like, that's
Although I will say, I was on the bus tour with him in Ohio and in Wisconsin and in Iowa and in Michigan. He actually made that case everywhere we went, and he made it arguing that it was the Republican governor in that state is the one that should be given credit for the rebirth of the economy.
Yeah.
No, it is very different.
We should talk though for a second about the substance of particularly of the
outsourcing.
Yeah, I mean
that became the substantive subject of the week that as reflected in those ads, right?
And it could be devastating. I mean, it came out. It started with the Washington Post story talking about outsourcing under Bain. They haven't approved of the story. The Romney campaign, they've been fighting against it, but the cat's out of the bag. The Obama people grabbed a hold of the thing, and it could be really devastating for the Romney campaign. I mean, he's the guy who creates jobs. It's all about his private sector experience, and now they are, gutting it basically in these ads.
And the truth, like so much in politics, the truth is a lot more complicated than the 30-second ad would have you to believe. The ads are based on stories regarding job growth overseas, that these were companies that Bain invested in, and they added employees at overseas facilities. At the same time, they were adding employees in the U.S., and that you could make an argument, and the Romney campaign has made a very vocal argument this week, that those jobs did not take away from any jobs in the U.S.
Right, but that's a refined argument for politics.
Absolutely.
Right.
It's
and
not
the
something you
fact
can
that-
distill into a 30-second ad.
And the fact that they're pushing back so hard. I mean, they're even asking for a retraction of the original Washington Post story on this.
They've
And
got
that
a
they really are worried
13-page
about this
dossier
argument.
on that story and these ads
Yeah.
to
Tells
make
you how
the
sensitive
case.
the
Yeah.
subject
Well,
is,
if you
right?
lodge in enough people's heads just the word outsourcer, and they've been saying outsourcer in chief, pioneer in outsourcing, that germinates, and that can be really, really devastating.
One of the more interesting numbers in our poll was actually, if you look at we had asked the question about Bain, whether or not it's a good thing that he has a record as a businessman or a bad thing. Now you got to remember, this is basically the hallmark of Mitt Romney's campaign, and more voters, I think about 28% to 23%, more voters said that it was a bad thing. His business background was a bad thing, and if you look into the swing states, it was even bigger.
It was worse. That's what it was.
I think it was 33% and 18%. So clearly, the message the Obama people have been driving is actually, it seems like there is some empirical evidence now that voters in swing states are actually seeing that, and it is doing damage to his reputation there.
So I think the broader lesson here is that there are two narratives here. That the Obama narrative is, I saved the country from disaster, and we're on our way back. And the Romney people have to destroy that narrative. And the Romney narrative is, I'm the one who knows how to create jobs. That guy destroys jobs. And the Obama people have to undermine that narrative. And that's really what the ads were about, to me at least.
Yeah.
Well, and it's particularly important for Romney to push back against the Obama narrative, because people don't know Mitt Romney.
Yeah.
And so half of what they're learning, and maybe more, is coming from Obama, not from Romney
Well, that's
himself.
what our poll showed, is that as people get to know him more, his negatives keep creeping up. And
We'll see.
The more
we'll
you
see.
know.
Long way to go.
Yeah.
And we'll be talking about jobs a lot in the next 4 or 5 months. Thanks, guys. Appreciate it very much.
Thanks.
So it was a momentous week, policy and politics and campaign news. We'll revisit all of that next week on DC Bureau from the Wall Street Journal.